Welcome back to Visions for Health. I'm Wendie Trubow, and my guest today is Dr. Rick Sprague. He holds a PhD in psychology and is a licensed clinical psychologist. Did I get all that right?
Yes, you did.
Welcome.
Yeah, thank
That's
you.
a lot to say.
Yes.
So, tell me how you got into psychology.
That's a really good question because that goes back a long, long time.
Yeah.
Okay, I was an undergraduate at Stanford, and the most exciting professors that I had were the psychology professors, and I just gravitated to them. And I ended up my senior year in a tutorial with the chairman of the department, Al Hastorf, who's a very, very well-known, now retired social psychologist. And he strongly endorsed me to go on to graduate school. I had my choice among several of the better schools and ended up at Duke, where I majored in clinical psychology.
This is for your master's or this is for your PhD?
In psychology, you can go directly from bachelor's to PhD,
Okay.
given your credentials and basically your track record.
Okay. So you went right from college at Stanford to Duke?
To Duke, yes,
Okay.
which was at that time considered one of the really top clinical schools, and I really had a good experience there, very enjoyable.
Okay.
And then I came back to the civilization of New England.
Are you from New England?
No, but I had been here, and I had a real affinity for New England. So I wanted to come, got an offer, and have been here ever since.
Now, do you have a particular focus in your practice?
Well, I have a dual focus. I am a clinician in the traditional sense of doing interpersonal psychotherapy and coaching and counseling, both with kids and with adults, and sometimes whole families. But I then, after being here a number of years and working with a lot of youngsters with complicated neurodevelopmental handicaps, I gravitated into neuropsychology and did my postdoctoral work in neuropsychology, adult and child.
Okay, so you just said a whole mouthful of stuff.
Yeah.
So you work with people in, when you say counseling, therapy, interpersonal, working out issues.
Yeah.
That's one aspect.
Yes.
And then when you say neurodevelopmental issues for children, what does that mean?
Well, it means the child is not showing a normal trajectory of development, and specifically in terms of their intellectual development and their social capabilities. They are behind a curve, and there's almost always a substantial amount of anguish associated with that on the part of the parents and oftentimes on the child's part as well. And so my work then gets to be sort of double focused. First of all, what can I do to mitigate the pain? And then beyond that, can I fully evaluate what's going on developmentally with this child and come up with a plan that can be followed through not only by the family but by the school system.
So is that an IEP that you're referring to, or
Well,
is that somewhat
most
separate?
often, yes. It should, in most cases, result in an IEP, which means that the school system is acknowledging that the child has a genuine handicap, genuine special need or needs, and that they're going to then provide an individualized plan and program, either in the public school or, if need be, in a specialized setting.
Now, when you got your PhD, you hadn't yet gotten into child psychology, correct?
Well, no, I was actually at that time, I was doing my sort of externship in a community mental health center in rural North Carolina. It was a triracial community, very interesting, complex population of people, including an Indian tribe that thought they were and claimed they were and probably were descendants of the Virginia Dare colony, one of the first, landings of Europeans on the coast. And they had a very well-developed, very insular community, and I was taken in and I was helpful to them, I think, as well as the general school population. And this was at that time the poorest county in a state that ranked only above Mississippi in terms of per capita income for the general population. So it was an awfully socioeconomically stressed setting with a lot
Underserved.
of people who had very, very substantial mental health problems and needs. So it was trial by fire, and it was something that stayed with me in all those subsequent years.
So you, at a very early part of your career, were introduced to
Yes.
and got involved with child psychology?
Yes.
Okay.
Yeah.
And when you moved up to Massachusetts, was it a culture shock to have gone from what I would consider to be underserved to Mecca? Medical services galore?
Well, I moved in with my son. We were seen as if we were brothers, and people would ask me, is he your little brother? And I said, no, he's my son. Okay, it was just the two of us. And we found an apartment in the South End, which at that time was not yet, the renaissance of the South End was an idea, was not a fact. So in terms of my experience of being in a disadvantaged and oftentimes rather rough and tumble community wasn't any different, except that it was urban rather than rural.
Okay.
And I was at that time just a poor postgraduate student, and I did all my rounds on a 10-speed bike right through the winter.
Oh, in New England.
In New England. All right. But I came to love Boston.
So when you do the evaluation on children, how do children first off get to you?
Most of my referrals now are directly from the parents. Oftentimes they're instigated or recommended by school people, teachers or counselors or special ed administrators. And I get a sizable number of referrals now directly from pediatricians. Okay. And most of the issues are about neurodevelopmental difficulties. The child is not showing the capabilities that one would expect for their chronological age.
What does that actually mean? Like they can't tie their shoes at a certain age, or what does that mean when
Well,
they
it
get
could,
referred?
yes, it oftentimes is manifested in motor immaturities, but most prominent difficulties in kids that bring them in for an evaluation are the collateral emotional problems. Okay, they're anxious, okay, and oftentimes combative when stressed. So they become difficult children, and so the family as a whole really needs to focus. And that's what I find most challenging and most rewarding. And in most of those cases, there are some neurodevelopmental issues that need to be really carefully evaluated. So I do pediatric neuropsychological evaluations in order to get to what exactly is going on here developmentally, and what should we be asking or demanding of the school system in terms of an appropriate program that's going to be helpful and hopefully bring that youngster into a state of comfort as well as helping them catch up with their peers.
So how do you evaluate the child? Is it from the moment you see them? Because I'm imagining a 7-year-old is not going to fill out a form for you.
No.
No complex history from them.
No.
So how do you do that?
Well, with 7 and under, most of the initial evaluation is down on one's hands and knees on the floor. Okay, I keep an extremely rich array of very attractive play materials. Okay, everything from stuffed animals to toy soldiers. Okay, and every conceivable game that will be selected by the child or selected with my help, depending on their cognitive level. And so we do an awful lot of playing, making, doing, and in that process, it's very frequently the case that a child who's under stress at home will elect to pull out the human figures, flag dolls, little people of all sizes, shapes, colors, okay, and various postures, and combine them with the dollhouse furniture. And before my very eyes, they are, without you having to find the words, which they, of course, usually lack, they are showing me through the play process what their major concerns and stresses, worries, or fears are. And then I simply do what most non-directive child therapists have done now for decades, is I maintain essentially an accompaniment to their play in which I verbalize what I see happening. And that, for the children who are ready, leads to their beginning to then respond to me and bring it out in language as well as through the play, which of course allows for nuances that you can't really see in the play alone. That then becomes the foundation for my counseling of the parents.
So you're watching the play, you're then naming what's occurring?
Well, I am in some, yes, in some way I'm giving names to the episodes or the events or the interactions, and the child will then engage me back. If I'm wrong, I'll hear about it right away.
Correct. They'll say, no, that's not what I mean,
Yeah, that's
or
right. Yeah.
that's wrong.
Right. So what tell me? So then I can say, of course, perfectly legitimately and easily, well, tell me what's going on here. All right. And those who are ready, in terms of their linguistic sophistication, can then shift from play alone into a therapeutic conversation.
So are you able to elicit the breakdowns for children in the play? Because it seems like if the play is occurring, that's relatively benign. So a child who gets frustrated or gets anxious, does that occur in the play?
I also have a full array of wonderful animal figures, most of which I bought at the Smithsonian. So they're really very, very lovely and are then a magnet for the kids. So we'll have a little home-like scenario, but the next thing you know, there are lions and tigers, you know, prowling, all right, which represent, for many kids, their anxieties or fears. I also have dinosaurs of all descriptions and sizes, including one of the favorites for the kids that have an awful lot of pent-up anxiety and anger. I have a T-Rex that's about like so, with a great big gaping mouth full of teeth. And you might be chagrined to see how graphic the representation of thoughts, feelings, and emotions in kids can be when they are free to give full vent to what's going on under the surface through play. Play therapy is our fundamental and by far our best tool in working with young kids.
Are the parents in the room when this is going on, or are the parents outside the room? How does this work?
It depends on the family. Okay, I had a mom with her 7 children, only one of whom was the real focus of concern, because this child had begun to resort to bullying, I think, to find her place and maintain her, sort of her place in the sun. But the mother needed to have everybody in on this. Okay, the child could have very easily been seen individually, but that was not what was wanted. And there was also an element of me too, me too, me too from all the other kids. And in fact, once that was said, okay, allowed, they came in and they all picked up upon their own particular themes with the materials that were at hand that suited them best. And it was just absolutely fun and games. It was like being in a little mini preschool.
It is a mini preschool.
Well, yeah. And with all that hubbub going on, you know, what I do is I'm doing 2 things at once. I'm listening peripherally to what's happening with the kids, but I'm also having a conversation with the mother that is enriched by the fact that I'm seeing the very things the mom has brought me as concerns in terms of the interaction between individual children. So I have to say it's exciting and it's great fun.
So how often are you able to make a substantial change in the parent's behavior? Because it's, you know, it is a two-way street. So action elicits response, elicits reaction, elicits more response.
Well, I would say to you, I think without seeming pretentious, that I always make a change. Maybe not as much of a change or the type of change that I would like ultimately or ideally to achieve. But you know, in counterpoint to these sessions with the child or children, I then see the parent or parents. Most often I see the mother and father together so that we can talk frankly about the whole historical pattern. What's happened here? How did this begin? What's going on now? What are the main stressors? What are the main points of concern? What are parents' hopes and fears, wishes, goals, and so on? And so then I help them create a plan for the family that oftentimes involves more vigorous seeking out of services either in the medical framework or at school to really support that process of change and growth.
Do you work with pediatricians to look at diet and exercise and sleep? Or do you do this yourself? How does that all play in?
Well, I am immersed enough, okay, in all of these multiple new and really very in some cases, very non-traditional ways of addressing people's physical as well as their mental problems.
Mm-hmm.
So I have conversations with the parents about what they need to do, obviously, to be at their best at parenting, and beyond that, what it seems to me needs more attention or more recognition in terms of the child, and diet is almost always high on my list. Because we have, you may be aware of the movement of getting people to do things about their diet so they don't develop, quote, the grain brain.
Yes.
Okay?
Yes.
Well, of course, I see this all the time. Every week there's somebody who concerns me, a young child, who's subsisting on a carbohydrate diet. And so I become very directive about that. That is just not okay.
Mm-hmm.
And I'm firm about it. I have to say, I have rarely had a parent turn their back, and that's a source of great pride for me. Because
do you see an improvement in behavior when you change their diet?
Yeah, I say what I really wish you would do are the following things, and this is why. Mm-hmm. And this is what we should see occurring as a result of making those changes. And it's not just diet, obviously, it's lifestyle. Things like the sleeping arrangements, mm-hmm. schedules, and most importantly, do the parents really have a positive system of discipline as opposed to resorting to punishments?
What would a positive system of discipline look like?
It means that what you do is there are extended and frequent conversations, parent and child, the nature of which, of course, varies dramatically, whether it's a preschooler or a high school kid, but the same principle applies. This is what we need from you and or require of you, okay? Mm-hmm. And these are the things that we can do to support and help you in achieving that. However, many of the things that you seem to take for granted, you should recognize as being privileges. So what we're going to ask you to do is link the two in the same way that mom and dad do their jobs in the work world, and then they get paid. So there's a contingency here. Mm-hmm. Things don't come from the sky. They don't come gratuitously. They come through effort mm-hmm. and good results. And so the positive discipline is all about doing that in a way that's actually supportive and congenial, as well as firm and consistent. So you have a plan for any one child who is, getting off the track in some way, or for the children as a collective, as a group. Okay, no squabbling. Okay, we're going to not do the squabbling and throwing things at each other. Mm-hmm. All right, that's a goal for these preschool kids in a setting where there are several children and sometimes only one parent available. So that's a goal, and over time, if reducing that uproarious play or potentially hurtful interaction happens, the children are learning that that's what brings the privileges that they previously had taken for granted.
So let me drill down into this. Yeah. There is some negative withdrawal about this in the sense of you've taken X, Y, and Z for granted. We're going to now link good behavior to the attainment of these things. Mm-hmm. So if your behavior is unacceptable or doesn't work in this family, X, Y, and Z may be off the table. Mm-hmm. So there is a negative punishment, but it's in advance discussing we expect A, B, and C. This qualifies as good behavior?
Yeah, there's no punishment if you're doing it right. Okay, and optimally, what happens if I can help the parents be sufficiently creative is that something new that's wanted becomes the incentive. Mm-hmm. That only can be achieved if they're willing to make changes in their behavior and conduct. All right. It is true that kids who are, let's say, watching too much TV or spending too much time with those infernal screens, particularly the video games, mm-hmm. okay, especially the combat ones, okay, yeah. Parents would like to have them doing less of that anyway, in many cases, so that there's a nice complementarity here between backing them off of that and saying, you know, son, this is not good for you to be sitting in front of this TV or this screen so many hours of the week, and that's a fact. And so the positive discipline is actually not a matter of engaging punishment, it's a matter of sort of redefining what is going on here and what's best for you as an individual, as well as what's best for the family. Okay, so from now on, yep, you can have that game box at certain periods that we're going to set aside and schedule, and it'll be yours and you can count on it, provided that you're getting your homework done.
Right.
Providing that you're not pushing your little brother around. Okay, et cetera, et cetera, et cetera, and it's really not rocket science.
So setting good boundaries.
Yeah, setting boundaries and having really clear-cut contingencies that are fully understood. And sometimes my role is to be sort of the coach and the mediator to help make sure that that doesn't somehow, for some reason, induce an element of bitterness that's unnecessary.
Then, do you work around allowances? I mean, you also work with young children, so at what age do kids get allowances? And
that varies tremendously with sort of the worldview and the values of the individual parents. If there is already an allowance in place, that's an obvious and very easy thing to tie to a positive discipline set of goals. All right? And if that's done openly, clearly, with some sort of lead time, it doesn't necessarily ever produce a discontent or dissatisfaction, because what the parents are asking are doable. Those things are not impossible. In fact, they're very simple. Oftentimes it's just, let's not do that anymore, okay? And more importantly, let's step up and be more conscientious about what you already know are your responsibilities. And all we're doing here is, we're not going to harangue you anymore, but we're just going to have a clear-cut set of consequences that you're going to be aware of. And yes, there are things that you've taken for granted in the past, but from now on, let's just do the right things, and you'll be enjoying the same privileges as you've had all along. Okay? Some kids need something new added into the mix, and others don't.
how receptive are children to these discussions? And they're essentially negotiations.
Well, they're negotiations, but they're ultimately, it's unilateral. If the parents are faced with a child who really has developed some very intractable bad habits.
Okay.
Okay, so that's where I frequently come in, because then I become a mitigating influence, because I'm not the parent.
So you can be the bad guy.
Well, no, I'm not the bad guy. What I am is the guy who can understand the child's point of view independently of the dialogue with parents that oftentimes is already kind of like solidified into a disagreement. Sometimes I can have a conversation about this and help the child get a broader perspective. Okay, I can give them examples of other young people who have been in a similar situation and it's worked out really well for them. So I guess you could say I'm sort of like a crazy uncle who's fun to be with and who can in some ways help the youngster back off of the, sort of their ingrained sort of resistance. They dug their heels in about this whole business about their TV or their video games. All right, and I have a neutrality that allows me, hopefully, to win them over and to see it differently, that what their parents are doing is really not a bad thing. In fact, it's a good thing. And they're creating a situation that makes the things that you want more readily and surely accessible to you, because it's actually, you do your job, you earn
get reward.
reward.
Now this seems very clear. What about children who are violent or don't listen? That seems like a much different root cause than you're watching too much TV, you're playing too many video games.
Yeah, that requires another level altogether if they're really violent. And in those instances, most often I help the parents connect with some organization that brings help directly into the home. All right, there are very good groups out there with very strong behavioral backgrounds who can come in and help the parents develop a behavior modification plan that involves much more immediate feedback to the child. So it's just like all the time. They've got a positive discipline system that's down at the microcosm level.
Right. That seems much more challenging to me.
Oh, yeah. Oh, definitely.
That's not a lack of rules or negotiation. That's simply...
Well, this is a home program now.
Yeah.
All right. And of course, in the extreme cases, the school system is going to feel the child's difficulties. It's going to spill over to some extent. And that's where one hopes that you can enlist the special education department of the school system to provide some support services in the school.
One can hope, right?
Yeah. Well, that's one of the things that I pride myself on. Okay, that's writing a report or an advocacy letter that they can't refuse.
So do you work with insurances?
I live in a world in which the insurance companies are a major sort of parameter, dimension of life.
Okay.
Okay. So I endure that fact of my life.
But you accept insurance?
Oh yeah, I have been. Yeah, I accept that. You know, if they're willing to pay, I'm glad to receive payment.
We'll work for pay.
Right. Yes, I have a billing agent who very conscientiously compiles all of my recorded hours of service and submits that to all the various insurance companies, and they do a very good job. And I have to say, over the course of years, for the most part, the insurance companies have been absolutely consistent in following through. So I don't have any real complaint with the insurance industry other than the fact that they are sometimes hard to persuade of the necessity for care for some of the more complex and lower frequency kinds of problems. I don't always get a clearance, for example, for a neuropsychological evaluation that I know very definitely is absolutely essential in order to make the case with the school system most often, to provide the level of supportive care that the child is going to need, or the placement that's going to have to be funded.
But parents could pay for that separately?
Well, parents might, but most parents can't afford, if it's certainly if it's outside placement, outside of school. This has got to come through what is typically a very, very arduous process of documentation and argumentation, and basically winning, if necessary, through an appeal of some kind. You know, the right of the child to be provided with that costly service.
I feel as though we've just started to scratch the surface of this topic, and we're just about out of time.
Oh.
I know, right?
I'm having a wonderful time.
I know.
I like to talk, okay? I was an executive officer for 30 years, and I would talk and talk and talk and talk, and as I've grown older, it hasn't faded as a sort of a compulsion.
You haven't outgrown that?
Yeah, no, and I can tell you when I was an ADHD little boy in the, I think it was the 2nd grade, they had a picture of my mother in front of me on my desk, taped on, with her finger up, and a caption, "Now, Ricky, try not to talk so much."
So as we wind up the show, you're going to be practicing in the Dedham office.
Yes.
At Visions Healthcare.
Yeah.
So coming soon.
Yes, coming
imminently.
can't come soon enough. Okay.
And you see children, and you also see adults, it sounds like?
Oh, yes.
So you see people of all ages?
Oh, yeah. There's a gerontology component as well.
Okay. And you do accept insurance?
Yes.
And, I mean, it's been an absolute pleasure having you. Thank you so much.
Well, I really enjoyed this conversation.
Yeah, this was,
really,
I think, just a drop in the
delightful.
bucket on this topic.
Oh, yes. Have me back anytime. I can talk endlessly.
We'll do this again. Thank you for joining us for another episode of Visions for Health. I'm Wendie Trubow, and my guest today is Rick Sprague. He has a PhD in psychology and is a licensed clinical psychologist.